Welcome back to Talk to Doc.
Yes, and we would like to greet the whole family of Dr. Bengson and the whole clan. They're
Who are
watching. Thank you.
Sure. So, it's now time for our audience to ask questions. So, who has questions po for Dr. Casala?
Dok, kailan po ba kailangang mag-dialysis ang isang diabetic?
Meron ding dialysis ang diabetes.
Yeah, kasi pag nagka-complications sa kidney, kaya nasira yung kidney, then dialysis will be necessary, especially if the function is not anymore adequate to support the body.
In fact, sir, di ba, kidneys is the #1 organs affected or
Yes.
damaged by
Yeah,
diabetes.
it's one of the more common complications of diabetes. Well, yung tanong na kailan magda-dialysis, it depends on how much function of the kidneys remaining, no? Kasi kung sira na talaga siya, that means the body cannot be supported by the remaining kidney function anymore. The patient will really feel bad, no? Like nasusuka lagi siya, hindi siya makakain, walang gana kumain, and nagiging acidotic yung blood nila, tumataas yung kanilang mga potassium, which will endanger the patient already. So the patient will require dialysis.
No.
And the problem there is, when you start dialysis, it's going to be especially if the kidneys are damaged already, it's going to be a chronic dialysis
Continuous
already.
na siya.
Continuous na siya.
Lifetime.
Kaya kailangan
So, ang
sumusunod
importante
talaga
talaga
sa
is
doktor.
really prevention.
Good evening po, Doc. Gusto ko lang malaman, what if the patient has hypothyroid? What is his risk of developing diabetes?
Interesting
Well,
question.
in a way, hypothyroidism is also an endocrine problem. In a way, if you are hypothyroid, it will also predispose you to diabetes if you have a diabetes predisposition. Why? Because hypothyroidism will cause a lowering of the metabolic rate. Okay? So kung mababa ang metabolism ng patient, then if he's eating a lot and he's not exercising and the metabolism is low, then the more you'll develop diabetes.
Kasi
But
she
that
will
is
gain
only if the hypothyroidism is not treated.
Yun na, dapat
But if the
makontrol.
hypothyroidism is treated, then it will not give additional predisposition.
Okay, next question.
Yes, hello, Doc. I just would like to know if there is any difference in treatment of diabetes during childhood, 30s, 50s, or senior citizens with high cholesterol and high blood.
Well, in general, we are more aggressive when treating younger patients. Why? Because, yung mga younger diabetics, they have longer lifespan, right? So,
May pag-asa pa. Marami pa silang pag-asa.
so that means if you don't control the diabetes very well, aabutan nila yung complications, no? Unlike very old patients already, if they are already 70 years old. So, kahit hindi masyadong control ng diabetes, hindi siguro aabutan niya yung complications, right? Pero
aggressive, Doc, meaning like...
aggressive, like, we have certain levels of blood sugar control that we target for young diabetics compared to
elderly.
all elderly. For elderly, we're not very strict compared to very young.
Next question.
Good evening, Doc. My friend has type 2 diabetes and she's already taking maintenance medicine. So, why is she still losing weight? Is this normal?
Okay, the most common cause of weight loss in a diabetic is uncontrolled diabetes. So, because the blood sugar is high, you lose a lot of weight because you get dehydrated. And also, if the blood sugar is not controlled, the nutrients doesn't get into the cells. That's one of the most common causes of weight loss among diabetics, even if they are taking medications. But also, maybe some medication will actually help patients lose weight. That's why metformin, we give metformin for the diabetics who are overweight because it helps them lose weight. So if you are not overweight, then maybe that medicine will not be good for you.
And you have a test to determine that,
Yes.
Doc, di ba? So,
Meron, of course, common blood sugar, but there's a test that we always do. We call it HbA1c. That's your average sugar for 3 months. And we measure that ideally every 3 months to make sure that the diabetes is well controlled.
Importante.
Saka importante rin siguro, Doc, to remind them. Kasi it doesn't mean that you're taking medications yung diet mo will not be modified din.
Correct.
So, kasi baka yung kain niya bago siya naging diabetic, sa same pa rin kahit na nakagamot siya. So,
In
hindi
fact, some patients have this notion that, oh, why will I diet and exercise? I'm already taking medicine.
medication.
You
Yun
have to
ang
strike a
problema.
balance between lifestyle and diabetes. It's important that in diabetes, you have to change your lifestyle, okay? You don't have to always depend on medication. That's number one. Number two, it's important that you always check your blood sugar to maintain and to make sure that the diabetes is well controlled. And for family members, which is actually more important if you're looking at prevention of complications, the family members should always be screened because the early diagnosis is better than late diagnosis because you can prevent complication.
Thank you very much for sharing your expertise with us, Dr.
Thank you,
Casala.
Marvin. Thank you,
And thank you very much to our viewers for making us part of your health regimen.
And for all those who emailed in their concerns, thank you and keep them coming.
Next week, we'll be talking about eye diseases. So if you have questions regarding this matter, please email them to us. I'm Maricel Laksa Pangilinan.
And I'm Dr. Oyi Balburias. Remember, don't be afraid to ask because we can
Talk to Doc.
Your doctor has seen many different patients, but none exactly like you. You are unique. The more your doctor knows you, the better he can help. And the more you know about your condition, the better decisions you can make. So tell your story, ask questions, talk to doc.
Your health depends on you and me.
A message of concern from the Medical City.